Good afternoon. So today we are going to do a hair transplant on Mr. Arogyam from Arunachal. So as you can see, he has a grade 4 plus to grade 5 baldness. So this is a genetic baldness. He has developed it from the age of 30 years. So now he has progressed to this stage. So he does have some hair here, but we have trimmed this hair. So that is why you cannot see it. The main baldness is in this part. But here also we will need to fill up these spaces, the empty spaces. So I am planning to do it with a minimal number of grafts, and I will finish everything with around 3000 grafts. So the main grafts will go in this area, which is completely bald, where he does not have hair. And the rest will just fill up the spaces. So he does have some hair which may not be visible on the camera. So we will fill up the spaces here. So I think we should be able to finish it in about 3000 grafts. So I have already drawn the hairline, so I have drawn it like this with the vertex here and going up like this, which we call the M shape or the inverted W shape. So this is the natural shape. So please raise your eyebrows. Please raise it. So when he raises his eyebrows, you can see that this point is marked out well. So this is the attachment of the frontalis muscle, and we follow the line of attachment of the frontalis muscle here. So this will give him a normal and natural hairline. So this is the first step of hair transplant, where we draw the hairline. And now we have already done the trimming. Actually, after the drawing the hairline, we do the trimming. So that part is also already finished. Next, we'll go to give him the injections, and then I'll make the slits here, where we later give that. Okay, so now we are going to do the second stage, which is slit making. So here I'll make the slits. So what we have already done is that I have marked out the line with some small slits, and along with that we have made the stamp markings. So as you can see, there are small tiny dots here, and this corresponds to 35 grafts per square centimeter. So this is how we'll make the slits, so that our slits are exactly maintaining the ratio, maintaining the density of 35 grafts per square centimeter. So what we will do is that on each of the dots, I will make a slit. So I'll just show you. There may be some slight blood here, so don't get scared about that. That's normal. Okay. So I'm doing it slowly now, but in actual practice we do it much faster. Okay. So this is how we make the slits. So this is one line, then this is the third line, and so on. So we will go on till we cover the whole area. And this is the second step. So here I will extract the graft. Okay, so this is the motorized punch that we use. I have already extracted a few, and this is how it works. So when I press the foot pedal, it rotates, and in this way we extract the graft, and the staff nurse pulls out the graft. Okay. So I'll just do a few slowly so that you can understand the process. completed the whole procedure of Mr. Taluk Debong. So as you can see, we have planted hair mainly in this region. So we have planted 3000 grafts. So you'll note that we have made this hairline slightly irregular. Okay, so you come nearer and these are the grafts. So it is still fresh. This is the part that we planted yesterday. It has dried up a bit, and this is the part that we have planted just now. So you can see that it is still still wet. So now we will give him the advice about the medicines to take, how he should bath. So we advise bathing after 3 days and shampooing after 5 or 6 days at home. We don't call the patient for shampooing and all. So there is a bandage at the back which is meant to cover the donor area, which he can remove tomorrow at home. So he is going back to Arunachal Pradesh tomorrow, today itself in fact, in the evening. So it is safe. They can patients can go back the same day after, once the procedure is over, they can go back for procedure. So full results will take 6 to 9 months. So now we have to wait for the results. This is of course just the preliminary stage. So we hope to see him again after 9 months.